I was recently asked, what methodology of note taking do I recommend during nursing school? When I was in nursing school, I used my laptop to take notes, and I set up a Google Doc for each of my classes. And then with each new class, I would just add on to that same Google Doc for that class. I did not write down things that were on the PowerPoint slides that I had access to after the class. I really focused on writing down things that my teacher said that were not on the slides that helped in my understanding of a topic. If my teacher really emphasized something or repeated something several times, or I got the impression that I would be tested on a specific fact or concept, then I would make the text bold or colored in my Google Doc. Then later on, when I was studying for my exam, I would definitely make sure to review those bold items in my notes. So the whole bold thing is something we use on our Level Up RN flashcards as well. If there are key words or phrases that we are confident that you're going to get tested on, we make them bold and red on our flashcards.